So now that you've looked at the parts of the respiratory system and you understand how it functions and some of the pathology that goes along with it, how do we treat those things? So in this lesson, you're going to get a good understanding of the common procedures that we use in the respiratory system. So first, let's take a look at our specialists or the people that perform these procedures. So on the left, we're looking at the pulmonologist. Pulmonologist. Break it down. Pulmon, combining vowel O, means what? Okay, lung. The ologist is the person who specializes in. So pulmonologist specializes in treating diseases of the lungs. Now on the right side, we have the word of the day, the mouthful word, but if you break it down, it's not as bad as it looks. So let's start out with odo. Odo means ear. Laryng or laryng, first the larynx, which is the voice box. Ologist refers to the person, the specialist. Okay, so otolaryngologist. The otolaryngologist treats diseases and disorders of the ear and the voice box and the throat. We don't have pharynx in there because then we'd have otopharyngolaryngologist. Okay, it'd be really a nightmare. But so this is your ear and throat, basically your ear throat doctor. So when we're talking about problems with that upper respiratory area, we're looking at an otolaryngologist. And when we're talking with that lower respiratory issues, we're talking a pulmonologist. So now let's delve into the specific procedures that these doctors order in order to diagnose or treat disorders of the respiratory system. So here we're looking at a respiratory therapist who is administering spirometry. Spirometry. Spiro means breathing. Meter is to measure. So she is using a spirometer to measure the capacity of this person's breathing. So what you can see here is we have a clip on the nose that closes off any air from entering the nose. And then there is a mouthpiece that the mouth is totally sealed around so that all the air going in and out of the lungs is coming just through this device. So she'll have the person take deep breaths in and breathe out, and it'll measure her lung capacity. How much volume of air is going in, how much volume of air is coming out. This is called spirometry. Okay, so we're looking another diagnostic kind of procedure to diagnose issues is a bronchoscopy. Okay, broncho means the bronchi or the bronchioles. Scopy is that instrument used to look at things, a scope. So in this case, we're using a bronchoscope to look into the bronchi and bronchioles. Okay, now this is done under a mild anesthetic. And we take the scope and insert it through the mouth down into the lungs to take a look at these airways and see if we have any issues there. So, question for you, which specialist that we talked about on the first slide would be the person who would perform this type of procedure. If you guessed pulmonologist, you would be correct because we're going down into the lower respiratory system and looking at the lungs. In this picture, we're looking at a laryngoscopy. Okay, laryng means larynx, voice box, scopy, to look at, visualization. The instrument that we use is a laryngoscope. And what you can see is this is actually a more rigid. It's not as flexible as the one that you saw for the bronchoscopy because all it's got to do is go to the back of the mouth. And we don't need to put someone under anesthesia for this. They don't need to be unconscious. Basically, all they need to do is be numb in the back of their throat so they don't feel the instrument and they don't gag. When you put that instrument in the back of the throat, if it touches any of the area, it's going to cause what's called that gag reflex. And then you're not going to get a good visualization of the voice box. So they spray a numbing medication in the throat and then insert this scope back in so that the doctor can take a look around. Done right in the office. Takes only a couple minutes to do this procedure. Now, which specialist would be the one who would perform this procedure? Well, since we're dealing with the upper respiratory system, this would be an otolaryngologist who would do this procedure. Okay, now this you may be familiar with and may have seen it, and this is called pulse oximetry. Oxy means oxygen, metry to measure. So what this instrument is doing, it's a clip that gets put on the finger. It is non-invasive, and by using a penetrating light, it is able to get a scan or an idea of how much oxygen is circulating in your blood. We call it a pulse oximeter because it's looking at the blood system, the pulse, to see if it can get a gauge of how much oxygen is in your blood. Now, it's a fairly accurate. It's not totally completely accurate. Someone has poor circulation in their fingers, or even sometimes like dark nail polishes can even sometimes interfere and give inaccurate results. And we even have them to the point now where we can hook them up to a smartphone and people can use them at home to monitor their oxygen levels at home. With our recent COVID-19 pandemic, this was a tool that was sent home a lot from doctors' offices with people who had COVID, but they wanted to try to maintain them at home rather than hospitalize them. So this was an instrument that could be easily used at home to monitor the oxygenation level of the patient. Okay, now those were diagnostic, figuring out what was going on. Now, some procedures that we use to treat problems going on in the respiratory system. This is a tracheotomy. Otomy means an incision into, cutting into. Tracheo is the trachea. So this is the base of the throat to give you kind of some landmarks. Right here is the collarbone, the clavicle. So this is right about where you feel that. If you feel it on yourself, you're going to kind of feel the end of the clavicle here and here. So right there in the middle is the place where we often cut for a tracheotomy. there's a gap in the cricoid cartilage there that gives a nice area and room, plus the supportive structures and the bones around there help to support the opening. So this is a tracheotomy. It's a cut into the trachea. This is a tracheostomy. Now remember, OS is a hole, okay? And this is a permanent or semi-permanent hole that is created. So the tracheotomy would be performed first, and then if needed, you would create the tracheostomy, which is the semi-permanent to permanent hole that stays there. In this case, this looks like a semi-permanent trach right now, or else it could be a permanent tracheostomy. I can't tell by looking at the hole. When you do a permanent, it gets finished around the edges. So in this case, this is a child who would be on a ventilator, and this collar here supports this tube, which is just a short tube that keeps the tracheostomy open and goes into the trachea so that the ventilator would get hooked up here to ventilate the child. So again, I would say this is at this point, could be a permanent, semi-permanent to permanent situation. You'd have to know the whole child's background and why they have this, etc. So tracheostomy is the hole that is semi-permanent to permanent for breathing through the trachea. So an otomy is cutting into, ostomy is the creation of a semi-permanent or permanent hole. Okay, thoracentesis. Thora refers to the thorax, the chest cavity. Centesis is that surgical puncture to remove something, typically fluid, but we can also do it to take air out. If you remember, two disorders that are related to this would be a pneumothorax or a hemothorax. In a pneumothorax, you would have air in that cavity, in that chest cavity, in the pleura. In the hemothorax, you would have blood in that chest cavity. And when it does, it pushes up on the lung and it doesn't allow it to expand. So we need to get that out of there. So we can perform a thoracentesis. So in this case, what we've done is there is a needle that was put into the cavity, and then the fluid that was in there is drawn out. Now, sometimes that's just what we do. We put the needle in, we draw the fluid out, and we're done. Sometimes we need to put a tube, replace the needle with a tube. It's called a chest tube that stays in there and just allows it to keep draining for a while. So sometimes it's a short procedure, in, take the fluid out, and we're done. And then sometimes we end up with the thoracentesis being converted over into what we call a chest tube drainage. And then the person will have the tube hooked up until the majority of the fluid has drained out. The next treatment procedure is a laryngectomy. Laryng, voice box. Ectomy, removal. Ectomy, exit, removal of. And this is in this diagram, you're seeing removal of the larynx or a laryngectomy. Right here is, I'm going to just purple here. Right here is the larynx. Okay, and after removal, you can see it is no longer here, it is missing, and what they've created instead is a stoma. Okay, that permanent opening. This would be a permanent tracheostomy, and we're now the we have bypassed the larynx, and all the air that goes to and from the lungs goes in and out through this stoma. Now think about what might be the most common reason someone would have to have their larynx removed. Cancer is the most common reason we see larynxes removed, and typically associated with smoking. Laryngeal cancer is highly related to people who smoke. I've had a couple good friends who had laryngectomies and have both since died from complications of cancer, and both were long-term heavy smokers. So just something to keep in mind. That is the common reason that we see laryngectomies done, though there could be trauma, there could be other issues, but that's the most common reason we see a laryngectomy done, due to laryngeal cancer. Okay, a pneumonectomy. Pneumo or pneumon, lung. Ectomy, we just said, was removal of a lung. As you see in this video, the main primary reason we see this going on is cancer, lung cancer. And the primary culprit in lung cancer, breathing in stuff you're not supposed to be, such as cigarette smoking, asbestos, there's a high instances in people who were rescue workers for 9/11, the initial responders, because they breathed in a lot of the dust and dirt, and it caused damage to lungs, which then ended up evolving into cancers. So um, since you have more than one lung, we can remove a lung, and it's called a pneumonectomy. We can also remove just part of a lung. So like this cancer is up here pretty high, but say this cancer was located just down here, we could just take out this lobe, in which case that would be a lobectomy. A lobectomy would be what we would call that. A pneumonectomy, removal of an entire lung. Okay, so with that, we come to the end of our pathologies and procedures for the respiratory system. And you know my saying, practice makes perfect. I suggest, doing the learning exercises that are at the end of your chapter. That's a good way to review. Use the review activities that are posted in Canvas, and of course go through and review the slideshow as many times as you need until the information becomes permanent in your brain.